First and foremost, Jackson, as we know it right now, cannot continue in its path, simply because the resources, the funding sources aren't there. It is of no fault of one situation, but of many complex and multifactorial reasons. And there are growing numbers of people who are coming to Jackson for care, but our resources and funding are dwindling, leaving our executive leadership team in the difficult position of having to make drastic changes in order to save the institution. There have been many questions regarding the possible reductions in workforce, and I want to clarify that the number of employees that have been let go as of today. Last Wednesday, we had to let go 22 executives, which include vice presidents, directors, and associate directors, for an annualized saving of $4 million. Today, we made notice to 20 union employees that they will be let go as of March 9th as we follow our contractual obligations with our unions. And we, as of today, eliminated 27 vacant positions. These are all annualized cost savings to the organization of $7.5 million.
We're 600 caregivers short from last year, so we're already staffed to the bone. You start cutting, thank God it's only 21 today, because if we ever get into the 1,200, lives are at stake.
This is just the beginning. We continue to look at all our service lines. As it is, we have a management team who's working around the clock. And we're engaging our partners to take a look at all our service lines and to see what would be the quickest way that we can arrive and close that gap. Needless to say, it is such a large gap that we will end this fiscal year with still a deficit that we will have to carry.
Because now they're letting go certain nurses, and we've already been working short-staffed. So as they continue to go on, we continue to work even more short-staffed.
We're looking at everything. We're looking at emergency room, we're looking at our OB programs, we're looking at all our service lines. Nothing can remain untouched. We need to reduce our current expenses by about 20 to 25%. That doesn't necessarily mean that it's going to be 20 or 25% of the total employee count, because as it is, since June 1st, this health system has seen a decrease of approximately 600 FTEs between our great efforts of reducing agency overtime, closing vacancies, and obviously redistributing a lot of the, and looking at our efficiency. So at this point, we do have to reduce by about 20 to 25% of our costs. Jim, at this point, I can only tell you that whether I announce 800 or we announce 800, 500, 1,000, or 15 or 2,000, it will be done according to our contractual obligation.
You can only stretch a nurse so far. You try and push patients after patients after patients coming out of surgery. It's a very acute area where we work. So, it's hard. I mean, it's really hard.
Patients will die. It's just not right. We need to fix the inefficiencies. We need to hold those at the top accountable. Someone needs to know, the Public Health Trust, the executives need to fix this system.
And the only thing I want to say to the residents of Miami-Dade County is that Jackson will continue with its doors open. Jackson will provide the quality of care, but Jackson will need to become a different system.